Hello, everyone. America's healthcare system is neither healthy, caring, nor a system. This was an observation that Walter Cronkite made over the course of his career as a journalist, noting the inadequacies of the healthcare system. All data that we have today seem to suggest that the vast majority of Americans are not exactly satisfied with our healthcare system. Most think that it needs major changes. Where we differ is just what those changes should be and how the system should operate. And this is quickly becoming the focus of the 2020 election. Where multiple views exist, we probably need to choose among them. And we need to do so by weighing the arguments and the evidence upon which those arguments are based. So here we have the makings of a debate. The US should implement a universal healthcare system. My name is Dr. John Patrick, and I will be your moderator today. I am a faculty member here, an adjunct faculty member here in the Languages and Communication Division, and I am the debate coach at Cal Poly. Speaking with us today are multiple students who are presenting you their ideas on this subject. Christian Olson is from the Aerospace and Engineering program here. Sawyer Sackett from Political Science. Marcia Blakely is not yet here. She might not arrive. So if she does arrive, well, I guess we'll introduce her when she arrives. And Chloe Bailey is from our philosophy program. So I would like to just turn the floor over to the debaters to get things rolling. And let's welcome Christian to speak.
Let's do a vote first, actually.
Oh, we're going to do the vote first, that's correct.
Yeah.
Those speakers, you'll hear time signals at 2 minutes, 2:30, and 3. So when you hear 3 bells, that means your time is up.
So the way that we're going to decide who technically wins this debate is the most change of vote that we have, and we're going to vote again at the end of the debate. So we'll do the vote again and see if people have been swayed one direction or the other. So we can turn the time over to debaters now if you'd like.
Okay. Christian, whenever you're ready.
Perfect. Thanks guys for showing up. So obviously everyone saw a flyer, saw an email, saw something about healthcare. Now, I'm glad that we're talking about this. Not just that we're talking about universal healthcare. It could be talking about anything else, single payer, private, anything really at all. Because the thing that intrigues me about this subject is it really is that. It is universal. I know that we all come from different walks of life, different backgrounds, and we have different goals. We have different places we want to go. The only way to get there is, well, by not dying, by not getting sick, by not having illness and all things that just are running rampant right now. And the way to solve that is with, well, your healthcare. And we've all been there, some on different levels than others, from the common cold to maybe a more diagnosable disease. And unfortunately, right now, this is unfortunately a hotly debated topic. Not because everyone loves what's going on here, but because everyone really dislikes what's going on here. And whether you think that we should have this universal care system or not, like I said, it is something that's going to ultimately affect you down the road, or right now, or in the past. So today, as you saw, I will be arguing the pro argument. That pro is to implement a universal healthcare system in the US. I hope that I can, if you're undecided, I can sway you. If you're pro, I can reinforce you. I'm not going to bombard you all with statistics or numbers right now. I don't think that's a great way to introduce myself. But I hope that if the time comes, I can provide you with some rather morbid and hopefully some uplifting stats. But with that, I look forward to a very civil debate. And like I said, I hope that for those of you that are undecided, I can bring you to a result.
Hello, everyone. So the problem, we're not disagreeing that there's a problem with the American healthcare system. There is very serious systemic issues inside of our healthcare system, but that problem is not private insurance. We need to bring the actual cost of healthcare down. We spend $10,000 per capita in the United States, more so than any other developed country. Having the government foot this enormously overpriced bill, this inflated cost, is just going to strain our already strained budget. It's going to raise taxes on everyone, and it's going to discourage innovations in the medical field. Now, some of the systemic issues that I'm talking about, one is the exponential rise in administrators in our healthcare system. As you can see here, over the last 40 years or so, we've seen an exponential rise in the amount of administrators versus the amount of physicians. Since 1975, we've seen about 150% growth of the amount of physicians in America, whereas the administrators have risen 3,200%. And so that bureaucratic load, this army of administrators and bureaucrats that are high salaried, that bloat the healthcare system, is a huge cost that goes into factoring how much treatment actually costs. And when we see where these points actually spike is with the implementation of government regulation, like the Prospective Payment System of '83, the Health Insurance Portability and Accountability Act of '96, and then the Health Information Technology and Economic and Clinical Act of 2009. We see these huge spikes as government regulation gets implemented, and thus we see a rise in this army of administrators and a rise in the overall cost of healthcare. One of the other things is the use of what's called defensive medicine. In America, it's extremely easy to sue physicians. And so what doctors do a lot of the time is they, even if they 100% know what the problem is, they will they'll run more tests. They'll run superfluous tests that don't really do anything to confirm or deny if you have a certain illness, even if the doctor is totally certain. And they did a study in 2010 where they found about 90% of doctors admitted to running tests, even if they know what the problem is, to help prevent them against being preemptively sued or go through litigation processes. And these are just a couple of the problems that our American healthcare system has. And we need to not necessarily have the government foot this giant bill, but rather fix the systemic issues. This isn't a Band-Aid fix. We need to fix the actual issues with our healthcare system, not just have taxpayers foot the bill for this.
All right, didn't say I was going to bombard you with stats and statistics, but here comes a little bit. So of course, what this debate I knew would ultimately come down to is money. That's what comes out of everyone's pocket. That's what a lot of people complain about when they go to the doctor. In fact, there's several allegorical stories I could tell you about very depressing scenarios in which money was standing in the way of someone's health. But just to brush the surface of this, in fact, when people argue about that money is the issue, in a 10-year implementation of Senator Sanders from Vermont's plan, it would actually save the U.S. $5.1 trillion in budget spending from this. And this is not like we get the money from somewhere else and whatnot. This is fundamentally money saved from the U.S. budget in the 10-year project. Now, again, money is the issue, and people often wonder, well, okay, how will this save anyone else money? Okay, another example. A triple bypass surgery in the U.S. as of 2016 cost an individual $75,000. That's an individual suffering from a heart attack, perpetually maybe a clogged artery, having to pay out of their pocket $75,000. Hopefully they have great insurance. I sure don't. And then if this was in the Netherlands as well, it would be $15,000. That's a difference of $50,000 for any individual suffering from this issue. Who knows what got them there? Who knows why they have that? But the point is, at that time, they have to pay that. So, with that being said, there are 500,000 people filing for bankruptcy because of these medical bills, as of 2016 that is, in the US because of their medical expenditures. That's literally 500,000 people that are saying, you know, I have X and Y and Z wrong with me, but at the end of the day, I spent all I can. I can't take any more house on the mortgage. I can't do anything that I can do right now. I'm filing for bankruptcy. And that's a shame to me. That makes me very sad. But if we implement these plans, and not, many people would argue things like Affordable Care Act or Medi-Cal have helped implement these programs, or at least work towards them. And we can get to that later, but ultimately the answer really is a universal healthcare system in which trillions of dollars are saved for the US, and then thousands upon tens of thousands are saved for the individual, and ultimately lives are saved.
Alrighty, so universal healthcare sounds pretty great, and I am all for implementing equality, promoting it, having an overall healthier population. But there is a better way that we can achieve that than universal healthcare. Where the problem lies right now is for the people who can't afford healthcare currently, which are low income and middle class Americans. Universal healthcare partially solves for a problem that doesn't exist. It pays for the rich to have access to healthcare, even though they already have access to it. We don't need to pay for the rich to have access to healthcare, which is what universal healthcare does. That would be more expensive on our end, whereas if we just focused on improving programs that we already have in place, that would save us money. So we could focus on expanding programs such as the Affordable Healthcare Act, which ensures that insurance companies won't turn you away just because of a pre-existing medical condition. We could also focus on improving the Medicare and Medicaid so that we could expand the cap for more low-income and middle-class Americans to qualify for that aid. These are all solutions at the root of the issue, not just Band-Aid solutions that puts the burden on taxpayers like us to help pay for people who can already afford healthcare. Additionally, a more common problem that lies with universal healthcare is how the quality of the care that's received is shown to decrease. In the countries that have implemented universal healthcare, there has been a result of long wait times, which can sometimes worsen the medical issue at hand because that medical issue is being left untreated for a longer time. There's also been reports of doctors having simply more patients than they can handle, which leads to more stress and for them to be more overwhelmed on their end. So there would be lower quality healthcare and higher taxes overall when we could simply just put in the effort into strengthening our pre-existing programs. That would cost less and increase the taxes only for those who can afford to pay the increased cost. So let's just leave the Affordable Care Act in place, leave Medicaid, leave Medicare alone, and strengthen those while we have them. There's no point in doing away with all of those programs that we've invested so much time and money into just to put into place universal health care, which would end up costing us more. Thank you.
Thank you. Start collecting things. Are there audience members who have questions they would like to pose or arguments they would like to pose to the debaters?
And you can just raise your hand if you don't want to text up here. It's up to you.
Start here.
Yeah, I think I missed the part where you said that Sanders' plan would bring down the cost of procedures.
Yeah, so it's an interesting thing. Basically, with a lot of people care about the logistics as well of healthcare, such as co-pays, insurance, non-insurance. So with Sanders' plan of universal healthcare, not only would it reduce the cost to the U.S., but it actually would reduce your individual insurance costs. So before we get to your thing, a lot of people, the average right now actually for across the board is $10,000 people are paying for annually for their insurance. This is kind of an average of high, middle to low income people. The average with universal health care would come out of your taxes. That's kind of the general consensus among most candidates right now on where that money would come from is significantly lower. It varies depending on which candidate you're talking to, but the average is around $6,000 to $7,000, sometimes even lower. So with that, those payments of taxes would eliminate co-pays, perhaps eliminate often in and out of network costs, which is a major problem with nearly anybody who has some sort of rare disease or rare, chronic illness. Say the most prominent one I'm aware of is hemophilia. Say you have a bleed or you have something, you go to a hospital, you have to get a thing called factor to stop the bleeding. You're in such a panic because you're dying, and you tell the doctor, I need this procedure done, I need to blah, 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 and you get it done. They tell you, you might hear a mention or see on a piece of paper, this is in or out of network. All that has to do with is with insurance companies. Who owns a certain share or part of some sort of medical procedure? That will be eliminated. That's one of the major parts of it. But on top of that, it's just co-pays, a little cheaper.
Other audience questions? Other audience arguments they'd like to have addressed? Yes. 1, 2, 3. We'll go in that order.
Chloe, we heard you speak on strengthening our current plans. So what is your plan? What is your idea of what strengthening is?
Yeah, so I read a little bit about strengthening the Affordable Care Act by adding caps on premiums, deductibles, and other out-of-pocket costs for everyone based on income. And it would also provide automatic enrollment for everyone to achieve coverage that qualifies based on their income.
This is my 2 over here.
I'd also like to present the idea that suppose if universal health care would drive up costs, I think that with privilege comes responsibility. And I think those who are privileged have the responsibility to collectively come together with that privilege to put together money so that the person down the road who may not have that privilege can go to the doctor, even if costs are driven up.
So it sounds like your forming argument is that people with power and privilege have a responsibility to those without.
Yeah, with privilege comes responsibility, and I believe that the responsibility is related to the person, say, down the road who can't afford universal health care.
So this is a good question to pose to the debaters. Do people with wealth and power have the responsibility to take care of the rest of the community?
Well, they certainly have the responsibility to pay a little more than they already are. That's what I would say. I'd say that unfortunately we have these mega billion, trillion, whatever number you want to call it, corporations that are, it's a different issue, it's a different debate, not paying taxes enough really. But the argument that was posed on the con side actually of this whole, should the wealthy, should we pay our taxes just so the wealthy and the poor can have the same health care? And I think it's a bit of an immoral argument in a way, arguing that though just because someone is lesser of income, lesser of opportunity, lesser of privilege, that they don't deserve the health care that we all have.
Seems like the college should have the opportunity to respond to this as well.
Well, to answer the first question about whether or not those that are more privileged and are typically wealthier have a responsibility to care for those who are have a responsibility to those who aren't, I do believe that they have a responsibility to help those who aren't as privileged as they are, which is why we would kind of promote having a higher tax on the wealthy, those who can afford, like I mentioned in my argument, who can afford to pay that tax to help those who can't afford healthcare in the first place.
And if I may add, we don't disagree that, you know, we live in a society where we do take care of each other, and like our ideas aren't incompatible with the wealthier paying higher taxes. But what we're talking about with, as Christian brought up, the most popular plan, Bernie Sanders' Medicare for All system, we're not talking about raising the taxes like a couple bucks. We're talking about raising it trillions and trillions of dollars in order to afford the cost of a universal healthcare system based on Bernie Sanders' Medicare for All system. It's, yes, everyone should have access to healthcare, and especially people who don't have the financial capabilities to access good healthcare should get it. But we're talking about the implementation of something that's going to literally cost more than our current deficit. So we need to figure out how we're going to do this in a cost-effective way. And that's why the argument of bringing down costs in general is vital to our what we're saying.
Any of your opinions relate to Bernie Sanders' healthcare proposal?
Yeah, so I would say I'll be on the pro side. He was one of my main sources when citing a kind of a framework, how to implement that, how to implement a universal healthcare system. Yeah,
Oh,
definitely.
you know his whole healthcare plan? Have you read the entire speech or anything?
Yeah, so I've watched so far all the presidential debates, which they talk about a little bit there. But yeah, if you go on his website, you can. I've read it too a little bit. It's very lengthy, but I've read the majority of it of what's going on there, and yeah, it's really good.
All right, thank you.
Other audience?
I was just curious about if you happen to have offhand the source. You said that that universal health care would lead to lower quality health care. And I've actually heard people quoting the opposite, and then quoting, European countries. I was wondering if you had a source about.
Yeah, do you mind if I actually pull it up? A lot of what I read about that was from kind of people living in countries who already have universal health care, talking about how it's negatively affected them. One of the cases I was reading in particular was about a family in Britain who was trying to have access to health care and ended up just being shoved around rooms, and it was just really, really poor circumstances for that family who had access to health care, but only because it was universal health care. But it's called, let's see, The Good, the Bad, and the Ugly of England's Universal Healthcare System from theweek.com. This is just a personal story.
Yes.
So, on the con side, you guys talked about a lot of efforts that could be made to improve the current system.
And so when you bring up examples of where healthcare for all wouldn't necessarily work, or where there's some complications, like with this British family, could we not also put the same effort towards like fixing those kinds of issues to make a healthcare for all that works for everybody? Like, what makes these issues unsurmountable? You know what I mean? Like, what makes this particular problem with the British family, like, why couldn't we fix that?
Okay.
Oh, absolutely.
So again, a big thing that we found with the research that we did in this is that we, as a developed country, are spending more on healthcare, and we're getting less access to it. So it's not necessarily an argument of is the healthcare right, but that the cost of healthcare in America is extraordinarily higher than any other developed country. You look at countries like Britain or Canada or France, and they're roughly spending between $4,000 to $5,000, maybe $6,000 per capita per year on healthcare. The United States is spending $10,000. So we're spending more for not better healthcare. It's not like socialized medicine has a better healthcare system. It's that it's much less expensive because of things that I had brought up before: rise of administrative costs, defensive medicine, the amount of healthcare that certain parts of the population need. So like there's these systemic issues that we need to address to bring the cost down, because having the government foot the bill for it is we're still going to be paying that $10,000 per capita essentially. It's more so an argument of bringing the overall cost down through the practices, a lot of it through regulation that has increased the price of healthcare.
Is it your argument that Medicare for all would still cost that same amount, that same $10,000 per capita?
So the majority of the issues aren't really addressed by the Medicare for All plan. It's a transition to a government-run healthcare system, such as like there is in the United Kingdom, for example. If you look at Germany or France, there's still elements of a private healthcare system. Britain is the only example that I came across of like Western developed nations that have a fully government-run healthcare system.
Anyone else in the audience? Did I see a hand? I thought I saw it. So a couple things I want to press forward with, because I think these are areas of the debate that are important to explore. But there are multiple different sorts of ways in which different countries, like you were just saying, structure healthcare to try to control costs or not control costs. So in England, you have what's a single payer, single provider plan, where it's similar to what our Veterans Affairs hospitals are like. The government runs the healthcare, they employ the doctors, so forth and so on. In the German model, which is single payer, multi-provider, the government merely acts as an insurance company and pays out to single providers or to private providers like doctors and hospitals with whom they negotiate prices. And then you have what we have, which is like a weird, unique thing in the world that's like private government hybrid, with both the government acting as an insurer and private insurance companies acting as an insurer. What are the advantages and disadvantages of each of these types of programs that people should be interested in comparing when making decisions about what type of healthcare they support?
I'll take this one. So the United States, we publish more biomedical research than any other country. In 2009, there was about 3,000 articles that were related to biomedical research. 40% of them came from the United States. The next closest competitor is Great Britain, and what did they have? They had about 300 articles compared to our almost 1,200. The amount of, honestly, like groundbreaking research and research into diseases that aren't necessarily massively like a huge problem. They don't affect a huge portion of the population, but like very rare genetic diseases that we are developing treatments and cures and vaccines to, and it's vitally important because yes, the amount of money it takes to bring a certain treatment to the market is very expensive, and that's why we see the super high prices for new drugs on the market, things like that. But as the market will dictate, as it's out for longer, as it becomes more accessible, the prices go down. And we see that we're able to, maybe not today, but 20 years down the road, have treatments to diseases that weren't there before and that are, for the most part, coming out of the United States. So, I mean, our advantage of having a system that we do, which is this weird, crazy hybrid, is that we have a very, very motivated biomedical research sector of the economy that literally is finding cures for diseases like Lou Gehrig's or Alzheimer's. And with the socialized medicine system, there's much less incentive for companies to do that.
Yeah, I'd like to add to that. I do think that the part of it being weird and crazy is quite literally weird and crazy how much we're paying and how much people are not being insured. I would agree that one of the better parts of having a system right now is the ingenuity and the creativeness of those industries that are looking at drugs. And it's to bring it back to John Paxter's point about which system I would really support. If I'm just going to cite Bernie's campaign for the Medical for All, it's that we're not going to just get rid of every company and everything and just have the government run it all, and we'll all just just all go to the same hospital like a brown sign. No, it will, and quite literally to quote his website, we will still continue to be independent private practitioners. However, the government will just be the one essentially running that and regulating that, which will not demolish the innovation. It will not demolish the ingenuity that the U.S. has right now in the medical market, and it will ultimately keep that going forward, which will ultimately give us what we're looking for in terms of healthcare, which is accessibility, while keeping the innovation.
We have 1 minute left, so we should probably just call that for this period, because there's not going to have time to respond. Let's move into closing statements, and we'll welcome Christian to come first. Close this one.
Still, thank you guys again for coming. It was a great time, pleasure and a privilege. As you heard, one of the bigger concerns is, I would say two things. I talked about money at the beginning, but a lot of it is private medicine and the kind of innovation that comes with it. A lot of people go to universities because of their medical program, because of what's going on there. Being college students, and if some of us are medical students, I'm not unfortunately, but I know a lot of us are, we want to go somewhere that is going to move the world forward. You want to research a certain disease, you go to maybe UCLA, maybe Stanford, USC. You want to go to these places because you want the medicine to progress. And a lot of misconceptions people have about universal healthcare is that this ceases to exist, that this innovation and this help for those niche diseases and even just general diseases just ceases to exist. And unfortunately, fortunately, that's just not the case, unfortunately for the argument. Fortunately for us, that's just not the case, especially with, ideally, Senator Sanders' plan with having this universal healthcare system. He would continue to keep these private little practitioners in place, such as universities, such as some drug companies, to keep this innovation pushing forward. So with that, I would just like to end with one statistic. 34% in 2016, reported by Indies Times, a research company, 34% of cancer patients reported borrowing money to pay for their treatment. I was researching, and this one just hit me extra hard. I really, I only know like one or two people that thankfully had cancer and were able to recover. But just imagining your friend, yourself, your parents, your grandfather, your grandmother, asking you if they can borrow some money, just they feel really bad. They're just asking, can I just borrow for now, to pay for their cancer treatment? I don't want to live in that world. I want to live in the world where they can get what they need, and I want to live in the world where we can all get what we need. So with that, I'd like to thank you for coming, and
So my first argument was more so about the costs overall, but we should talk about taxes. We honestly should, because Bernie Sanders' Medicare for All plan is the most popular option out there. And the main focus that Christian puts on is the savings in personal households. We see there's a net loss in how much a household is spending on healthcare. But what that doesn't account for is a 7.5% increase of income base that employers are paying, that businesses are paying. Now, I had actually a conversation with I work for a small business, restaurant in El Paso, and I had a very frank conversation with the owner, and he's straight up told me, what happens when their taxes go up is that they pass that cost on to the consumer. They don't take a cut in their profit margin. So essentially every place that's employing someone, every business, we're going to see prices go up. So it's not that employers are paying more, it's not that businesses are paying more, it is the consumer that's going to end up paying more. And that is often left out of the conversation of who's going to be footing the bill. It's going, at the end of the day, to be the consumer. And the thing is that this disproportionately affects the poor. If you're making $100,000 a year, that's not a big deal. If you're making $12,000 a year, that's a big deal. So the idea that businesses are going to pay their fair share, the way that Bernie Sanders' plan would implement it, is going to cost the consumer at the end of the day. Now, the other part of this is the research and development that go into drugs. I brought a little bit up about our biomedical research, but of the top 25 companies whose research and development exceeds $5 billion a year, 7 of those are pharmaceutical. Now, the average cost to bring a new drug to market is about $2.6 billion. So yeah, drugs are expensive, and especially in this market that we have. But by introducing this government regulation that's going to artificially reduce the price of current drugs on the market, it is directly going to hinder drugs in development that may be the cure to depression, Alzheimer's, Lou Gehrig's, cancer. And by hindering this research of the pharmaceutical companies, we're robbing ourselves and our kids of cures to future life-threatening disease, or by another 50 years or so. If you look back at 1918, the common flu, influenza, killed 50 million people worldwide. Today, it was down by a factor of 1,000. So the idea that we shouldn't advocate for this medical research that we currently have it's robbing our future generations of possible cures to diseases.
So as great as universal healthcare sounds, we just simply can't ignore the reasonable and logical aspect of this argument, which is cost. It's just $1 trillion price tag that we simply cannot afford to put into place, especially when an alternative solution exists that's cheaper and essentially solves the main problem at hand, which is making healthcare affordable so that people who can't currently afford it can afford it and can have access to it. We're not trying to say that we shouldn't make changes to our healthcare system. In the status quo, there exists a myriad of issues and problems that need to be addressed and fixed. But the way to address it is by improving Medicare, Medicaid, and the Affordable Care Act, which has already had so much time and energy and money poured into them to make them better, which I think we could improve. Additionally, no one here, I'm sure, wants to live in a world or in a country where we have to face the heart-wrenching scenario or situation where our grandma or a dear loved one comes up to us and asks us for money to afford their cancer treatment. But universal healthcare is not the only way to achieve a world where that doesn't have to happen. Because just simply improving Medicare and Medicaid would make it so that if we extended the limit for people to qualify for Medicare and Medicaid, we could have those middle-class Americans qualify for Medicare and Medicaid. We could have more low-income Americans qualify for those programs. But it would still be cheaper than universal health care because we wouldn't be covering the costs for people who can already afford to pay for their own health care today, such as the rich. So with those reasons, I hope that you all consider them accordingly, and I hope some of you have changed your mind at the end of this debate. Thank you.
All right, has everybody had their opportunity to get their vote in? Yeah? Okay. So you see the result of the second vote, and I'll go back. Let me stop this. And we'll go back to our previous. It's a pretty big difference. Okay. So it looks like Con won
Yeah.
because it persuaded the most people to change their minds during the debate. So a round of applause for everybody really.
For the record, we should still get universal health care. This is just purely a debate. Like, universal health care is the way to go. There's some serious issues in our system.
I want to go back and change my answer.
Well, I want to thank everybody for coming, and especially our debaters, and Christian for doing it all by himself. You're like a rock star, so good
She's
job.
the spirit.
Yeah. And there's probably leftover food in the next room. I actually haven't checked to see if there's any leftover food, but check before you go to get that. And there's a bunch of handouts on the table outside. that have the pro and con of the debate. Pick that up if you're interested on the way out. Thank you guys so much for coming.